diabetes affects more than blood sugar levels, but can also impact intimate health. Today we are going to dive into an important topic which affects many men, but is often not discussed openly: erectile dysfunction. So my name is Amber, and today together with me here is Mr. Win, pharmacist from Sunway Multicare Pharmacy. Welcome, Win.
Thanks, Amber, for the kind introduction, and I'm delighted to be able to share with you guys about this crucial topic today.
So Win, let's start with the basic. Could you first tell us what exactly is the connection between diabetes and also erectile dysfunction?
Okay, diabetes, aka high blood sugar, if it is not controlled properly, will actually causes nerve and blood vessels damage over time. And we know that erection has to do with these blood vessels and also nerve functions. And since you do not have enough blood flows towards this penis, so hence they will cause this erectile dysfunction problem. In fact, the study shows that men with diabetic tends to be 3 times more having this erectile dysfunction compared to normal people.
Wow, that's a staggering statistic. So can you explain further the science behind how diabetes actually causes this damage?
Okay, so diabetes will actually causes a condition what we call as endothelial dysfunction problem, which means that the blood vessels have issue with this dilation. So since the penis is unable to have these proper blood flows, so they're unable to erect properly. So at the same time, we know that this brain unable to send signals properly to the penis as well. So this will actually causes this sustainable issue and also this erection to happen at the same time.
That sounds serious. Any other factors related to diabetes that can worsen erectile dysfunction?
Oh, well, definitely. We know that most people who are diabetic, they tend to have this metabolic syndrome. That means they're actually having this high blood pressure, high cholesterol, or even obesity problem. And this will actually further worsen. At the same time, we know that those patients who are long-term having this high blood sugar problem, they tend to be stressful, depression, and they're having this socio-economic problem, and this will actually further impact on this ED problem.
That makes sense. So what can men with diabetes do to reduce their risk of erectile dysfunction?
Well, good news is, yes, there are methods that we can actually use as a prevention, because we know that since diabetes is the key, so controlling of high blood sugar will be the most important thing to do. So how to do that? Eat healthily, exercise regularly, take your prescribed medication regularly, and also at the same time, quit smoking if you are smokers, reduce alcohol intake, because we know that that will actually further impact on this nerve damage, and seek medical help as soon as possible, and to find out all this kind of condition so that we can have early prevention.
Those are really helpful tips, Wayne. It's clear that managing diabetes well could really make a big difference. So Wayne, any final advice for our viewers?
Okay, to all the men, seek medical advice as early as possible if you know that you have these early symptoms of erectile dysfunction, and don't be shameful to do that, because we know that actually this is a very common cases, and it happens to around 10% of the population of the men in the world. So we know that early detection is the key, and that will actually come to early treatment and also prevention.
Yes, you are right. Early intervention is very important as your health and well-being matter. Thank you so much, Wayne, for sharing your expertise with us today. So if you found this video helpful, don't forget to like, share, and subscribe for more health tips. Take care of yourself. We will see you next time.
Sunway Multicare.